Hi everyone, my name is Michaela Greiner. I'm a Concordia University, Texas nursing student. I'm going to be presenting a health fair exhibit discussing HPV, or also known as human papillomavirus. We're going to talk about the prevalence of it in our society. We're going to talk about some prevention tactics, some vaccination education, and then at the end of the presentation, I'm going to provide a post-test for you just to assess your knowledge. So first, let's get into a little bit about what is HPV. HPV is a group of over 100 viruses that are characterized as a sexually transmitted infection. So it's a little different than gonorrhea or chlamydia, which are bacterial infections and can be treated with antibiotics. The STI itself is spread through skin to skin, vaginal, anal, and oral sex. It can cause genital warts and specific types of cancers such as cervical, anal, penile, and oropharyngeal, also known as throat cancer. HPV is the most commonly sexually transmitted infection in the United States, with over 14 million new cases every year. More than 80% of men and women sometime in their lifetime will contract HPV.
Okay, guys, so the biggest thing to note with HPV when you're looking for indications or signs and symptoms of an infection is that most infected individuals will be asymptomatic or have no symptoms at all, and they will probably not know they're a carrier or that they're spreading the infection. Some individuals, on the other hand, will get genital warts characterized as soft pink or fleshy colored swellings in their genital area or sometimes in the mouth or throat. There are currently no approved screenings available to test for HPV in men. Unless they have symptoms for genital warts, then those can be treated. But for female clients, the first indicator of infection is oftentimes an abnormal pap smear result. And from that, we know that pap smear is a primary tool used to detect precancerous changes in the cervix. And the CDC recommends that women receive their first pap smear by at least the age of 21. Once an individual finds out that they have contracted the HPV infection, the first question is usually, is it treatable? And the good news is for asymptomatic clients, the virus usually resolves itself within 1 to 3 years, all on its own without any treatment. But the bad news is there is currently no cure for the HPV virus itself, but there are treatments for health problems associated with HPV, such as genital warts and cervical changes. Genital warts can be treated by healthcare providers or by prescription medication, but if left untreated, they may go away, they may stay the same, or they can grow in size and number. That being said, for infected female clients, once there's been noted precancerous cells in the cervix from a pap smear, there are additional testing and treatments that can be done with their gynecologist to address those high-risk HPV strands. And these can include a colposcopy, which is just a procedure to look closely at the cervix to assess those cells. And then if it is determined that those cells are in fact precancerous, there are 2 options to treat them. The first is cryotherapy, which is a treatment to freeze and remove the precancerous cells from the cervix, or some women will opt, or their doctors will opt for LEEP therapy, also known as loop electrosurgical excision procedure. This is a treatment that's going to remove the precancerous cells from the cervix using an electric current rather than freezing them.
Okay, y'all, now that we know a little bit about what HPV is, some signs and symptoms or indication that are associated with HPV, and then also how it's treated in a healthcare setting, let's talk a little bit about HPV prevention and how to mitigate transmission between partners. So the tricky thing about HPV is that it cannot be completely prevented using condoms and dental dams like a lot of other STIs. And for that reason, getting vaccinated is the #1 way to prevent new HPV infections and HPV-associated diseases and related cancers. The gold standard here in the US for HPV vaccine is Gardasil 9. It's going to protect us against 9 different HPV strands. So 2 of those strands are low-risk HPV types. Those are going to protect us against genital warts. And then there's 7 high-risk types that it covers that can lead or that are associated with related types of cancers. So for the CDC, their ACIP or Advisory Committee of Immunizations practice, They recommend getting vaccinated between the ages of 11 and 12, all the way up to the age of 26. So while it's recommended in between that adolescent age of 11 to 12 years old, if you're still not vaccinated in your 20s, please do so.
If you're a parent of a young adolescent or even a young adult that thinks you may be a good candidate for the Gardasil 9 vaccine, here are a few resources you can utilize to receive the vaccine in the Texas area. You can contact your city or county health department. You can call your regional DSHS field office. You can call 211 Texas to talk to a representative to help locate vaccine clinics in your area. You can call the DSHS immunization unit at 800-252-9152, or you can contact your local healthcare provider, doctor, or nurse at your local doctor's office, community health clinic, school-based health center, or local health department to administer the vaccine.
I'll be wrapping up my presentation by administering a 5-question post-test here at the end. After each question, you'll be given an adequate amount of time to pick your best answer, and then it'll be followed by the correct answer and rationale. Good luck, guys.
True or false? The HPV vaccine, Gardasil 9, can be used as treatment if an individual becomes infected with HPV. A, true. B, false. The answer is B, false. Gardasil 9 is not a cure for the HPV infection. It's utilized as a vaccine to protect individuals from 9 different strands of HPV that cause cancer and genital herpes. However, it is still encouraged to get vaccinated after being exposed to protect against additional HPV strands. What percentage of men and women will become infected with HPV in their lifetime? A, 20%, B, 40%, C, 60%, or D, 80%. The answer is D, 80%. 8 out of 10 or 80% of individuals will contract the HPV infection at some point in their lifetime, with teens and young adults representing the most affected age group. Which statement about HPV is correct? A, all individuals infected with the virus will show signs and symptoms of contracting an STI, such as itching, swelling, and burning upon urination. B, only women can become infected with HPV. C, only sexually active individuals can contract the virus. Or D, vaccinated women should still get regularly scheduled Pap screenings because the vaccine does not protect against all HPV types. The answer is D. Most HPV infections occur without symptoms and resolve on their own, but some strands can cause genital warts and cancer. While an infection can occur in both men and women, it is not exclusive to sexually active individuals because the virus can be spread through skin-to-skin contact. Answer D, regularly scheduled Pap screenings, is the only accurate statement. Some HPV infections can eventually lead to cancer in both men and women. What types of cancer are most closely associated with HPV? Select all that apply. A, oropharyngeal cancer. B, breast cancer. C, penile cancer. D, anal cancer. E, cervical cancer. And F, prostate cancer. The correct answer is A, C, D, and E. High-risk HPV strands can cause the cells in our bodies to change. This proliferation of cells may lead to oropharyngeal, penile, anal, and cervical cancer. True or false? Using protection during sex, such as condoms and dental dams, is the best method to prevent high-risk HPV infections. A, true, or B, false. The correct answer is B, false. While condoms and dental dams can lower the chances of contracting HPV, it does not completely prevent it. The safest method to protect yourself from contracting the virus is to be fully vaccinated.